Let's see kung guess. Sa guess na. Okay, pumasok yung guess. Anyway. Okay, let's go. So, these are the intent you should be able to discuss afterwards. And if you notice this slide, if you look at your PDF file, you'll know that at the fourth week again, you have your respiratory diverticulum through the influence of your retinoic acid will be coming out of in the pharyngeal part of the foregut. Now, once you have your respiratory diverticulum, you're going to have a ridge, and that is your tracheoesophageal ridge, and this will be divided by your esophagotracheal septum into the dorsal part, which is the esophagus, and the ventral part to the action of your TBX4 into your laryngotracheal tube. Okay, proximal part will become the larynx, the medial part the trachea, the caudal part will be the bronchi and the lungs. Now, another germ layer origin would be the endoderm. It will now become the lining epithelium of the larynx, trachea, bronchi, and your lungs. Now, the rest of the larynx will be coming from the splanchnic mesoderm, the fourth and sixth pharyngeal arch. Okay, with your cartilage, connective tissue, the cartilages, the muscles, and the trachea will be coming from your sixth pharyngeal arch. So this is a larger view of the illustration a while back. So if you look at this one, you're going to see here your proximal part, okay, foregut, midgut, hindgut. Then you have your developing heart, and that is now the area. The yellow one is your intestinal tract, okay. So this one, the cranial part, you're going to see here your diverticulum. So another illustration here will show you here the developing heart. Here you have now the stomach area, you have your respiratory diverticulum. And you now have here your pharyngeal pouches, and you know your 4 and 6 will contribute to your respiratory system. So this is now your respiratory diverticulum. You have your laryngotracheal orifice, the developing heart. So this is approximately a 5-week embryo. Another view here. Let's go there. So how does the lung develop? So the initiation of your morphogenesis will be from the coordinated activation and repression of your transcription factors. You have your hepatocyte nuclear factor 3 beta, the sonic hedgehog and patch receptor, the GLI2 and GLI3. And finally, your NKX 2.1. In regards to the lung bud, you have your fibroblast growth factor 10. Now, these another two factors, which are your FOXP2 and FOXP1, will regulate both the lung and your esophageal development. Okay. So the illustration here that you see, you have your tracheoesophageal ridge. It will be divided into a distal esophagus and your anterior tracheal area. Okay. And here you have your laryngeal orifice and a 5th-week embryo. You can see that already. And then you have the lingual swellings there. And then it becomes now a larger laryngeal orifice and the arytenoid swellings, which will become the cartilages of the larynx coming from the 4th and 6th pharyngeal arches. So this one is at 12th week. Okay. So if you look at this one, the division there, look at the slides here on the left side. So you can see primarily first here a single lumen there. So that would be the trachea. Then you have now the two parts here, the glottic area. Then this is you see now the esophagus here and the trachea. So the esophagus is dorsally located, and you should be looking for a landmark, which is the developing heart. Once you see the developing heart, you are in the anterior aspect of your developing fetus. Okay. Then if you go to the bronchi, it will now split into two, and that area around the bronchus will be your lung buds class. And this is the area of the stomach, and you now have that end there. The lung buds, you now have your bifurcation of the trachea in this area. Okay, so an overview, week 4, you have your laryngotracheal groove coming from the foregut class. At week 5, you have the left and the right lung buds pushing into the cardioperitoneal canals. Okay, and then you have formation of the main primary bronchi. At week 6, the heart will descend and the lungs into the thoracic cavity. You have your pleuroperitoneal foramen that will close. Initially, your pleura and your abdominal cavity, the thoracic and abdominal cavity are connected, class. At week 6, it should close. If it does not close, you will now have hernia there. You have two openings there, foramen of Bokdalek and Morgagni, which we will be discussing later. At week 7, you have enlargement of the liver, which will now stop the descent of the heart and the lungs. At 3 to 6 months, the lungs will appear glandular, and at the end of month 6, you now have the development of your alveolar cell type 2, which are your surfactant cells, because they will be the one to secrete your surfactant made up of your 50% cholesterol, 40% DPP, DC, dipalmitoyl phosphatidylcholine, and 10% surfactants protein A and B and C. Okay? At month 7, you have your respiratory bronchioles proliferating and ending in your alveolar ducts and alveolar sacs. So this is a slide where you can see now that is now your neural tube class. You have the developing heart. So this is the posterior area. That would be the anterior. If you notice now, you have the right lung bud here, left lung bud. Okay. So this is now the area of your bronchi. Okay. So this one here, you just have your laryngeal opening there. So the lung will develop week 4 to 5, your embryonic phase. Week 5 to 17, you have your pseudoglandular. Week 16 to 25, your canalicular. Week 24 to 40, you're going to have the terminal sac. And then from the late fetal up to 8 years old class, you have your alveolar phase. So you have your 4 fetal lung periods, embryonic to fetal, in which you have your pseudoglandular phase at 5 to 17 weeks, and the fetal phase, canalicular 16 to 25, terminal sac 25 to 40, alveolar late fetal to 8 years. Okay. So the stages of your lung development, your pseudoglandular, embryonic to fetal, okay? What will you see here? You will see your solid epithelial cells lined by your simple columnar, okay? You have about 15 to 20 terminal bronchial subdivisions, and the developing lungs will resemble glands. That's why it's pseudoglandular. Now you go to the fetal side, the canalicular phase, 15 to 25 weeks. The terminal bronchioles now will branch into 3 or more respiratory bronchioles. And then you have now 3 to 6 alveolar ducts, which is now lined by your simple cuboidal class. And the lung bud mesenchymal angiogenesis. And you now have cellular differentiation into your fibroblasts, myoblasts, and your chondrocytes. Now the terminal sac phase, 24 to 36 weeks, which is the second to the last histological phase. class. You have branching and growth of the terminal sac. You now have cellular differentiation of the type 2 pneumocytes and the type 1 pneumocytes. Okay. So the type 2 pneumocytes are your surfactant pneumocytes. The type 1 are your squamous or alveolar pneumocytes class. And finally, the alveolar phase from the 7th month, you have a final functional sac, which is about 20 to 70 million alveoli, okay? And where gas exchange now occurs between the alveolar space and the pulmonary capillaries. So pseudoglandular phase, canalicular period, terminal sac, and then you now have your alveolar period class. Now, in regards to the development, okay, you now have your trachea class, okay, then it will develop into the right and the left main stem bronchus, okay, and you now have your pulmonary segments here, okay, so the lung will divide into two bronchial buds. In week 5 of development, this will now enlarge to form the main or your primary bronchi. The right main bronchus is larger and more vertical than the left main bronchus. Now, this will persist throughout adult life, and because of this structure, there is a greater likelihood of the foreign bodies to lodge on the right side than on the left side. Now, the main bronchi further subdivides into your secondary. Okay, so this is now the secondary area there. So that secondary or your lobar bronchi will be 3 on the right side and 2 on the left side. Now the lobar bronchi further divides here, there, into segmental or your tertiary bronchi, which will be 10 on the right side and 9 on the left side. Further subdivided into subsegmental bronchi. The segmental bronchi are the primordial of your bronchopulmonary segments, which are morphologically and functionally separate respiratory units of the lung. So as the bronchi develop, they expand laterally and caudally into a space known as your primitive pleural cavity. Excuse me. So remember, your tertiary bronchi, you have 10 on the right side and 9 on the left side. Why 9 on the left side? Because of your developing heart class. Now the diaphragm. You have 5 structures contributing to the diaphragm. Okay. You have your septum transversum, your 3rd and 5th somite, the ventral pleural sac, the mesentery of the esophagus, and your pleuroperitoneal membranes. Now, the septum transversum will become your central tendon. The 3rd to 5th somite will be the musculature of the diaphragm. The ventral pleural sac will be your connective tissue. The mesentery of the esophagus will become the connective tissue around the esophagus and your inferior vena cava. The pleuroperitoneal membrane will become the connective tissue around the central tendon. So here at the illustration, this is the septum transversum, which is colored violet or purple, which will become your central tendon. Then you have your pericardio-peritoneal canal here, okay? Then you have the inferior vena cava. Okay. So the illustration here again, you're going to see the diaphragm, which is developing here. That would be the inferior vena cava. That would be the esophagus. Okay, you have your esophageal mesentery. Now you have a closed area where you have a central tendon, and this is the adult diaphragm. You have the central tendon, you have the inferior vena cava opening, you have the esophageal opening there, and then you have the dorsal aorta opening there. So contributions are color coded, and you have your PDF file. You can just look at it afterwards. What about the blood supply? Now, the blood supply will be your pulmonary arteries and vein. Now, this pulmonary system is not functional until after birth. That's why upon delivery of the baby, there will be the first gasping or breathing of the newborn class. So they do not breathe during the fetal stage. Okay? So it is not yet functional, unlike your excretory system. So the six aortic arteries will generate your pulmonary arteries. The veins drain into the pulmonary vein, then the left atrium, and the branches from the dorsal aorta will generate your bronchial arteries. So the splanchnic mesoderm will contribute to the following. They will become the cartilage for the bronchi and the bronchiole, the pulmonary smooth muscles, the connective tissue, the capillaries, the visceral pleura or your parietal pleura, which is attached to the lungs class. It is formed by the mesoderm of the thoracic cavity body wall. Innervation. Innervation will be your vagus nerve, cranial nerves 10, the visceral afferent and efferent for your lower respiratory tract, autonomic fibers from your parasympathetic fibers and sympathetic chains, and your diaphragm will be supplied by the phrenic and your lower intercostal nerves. Okay. So about the airway. The airway is now distal to your terminal bronchiole, and that will be your respiratory bronchiole, alveolar sac, alveolar duct, and then your alveolus. Okay. At 17 weeks or 19 weeks gestation, the terminal air spaces will have short, simple tubular endings. And then at 28 weeks or 30 weeks gestational age, it will now form shallow sacules. And by the adult, it will now have your deep cup-shaped alveoli. The lung volume. At 12 to 13 weeks, it will be about 0.05 cc, okay, per kilogram body weight. Then at 29 to 32 weeks, 1.9. And during infancy, newborn, you have 10 milliliter per kilogram body weight. Okay. So if you look at these two illustration, you will see your pseudoglandular phase, and then you now have the fetal phase here. There you have the developing alveoli, so that would be your alveolar phase. Now, during development, especially during the first trimester, any conditions like your infection, viral infection class, okay, any exposure to radiation, to medications, so fertilizers, you may have abnormalities. So the abnormalities, you're going to have your tracheoesophageal fistula, okay, with the corresponding esophageal atresia. Then you're going to have your lobar emphysema, overinflated lung. And then you have your newborn respiratory distress syndrome, or you call sometimes your hyaline membrane disease. Okay. And then you have your congenital diaphragmatic hernia and your azygos lobe. So look at this one. If you look at the development here, you have your respiratory diverticulum, that is the foregut area, and that will now separate here. That foregut area will now become the esophagus. Oops, sorry. Okay. There. And then you have your septum developing. So that is now your tracheoesophageal septum, which separated your trachea from your esophagus at 5th week class. There. fifth tweak. Okay. Now, at 6 tweaks now, you can see here, you have now your right lung bud and your left lung bud there. Okay, so you have your bronchial buds at fifth tweak, and you have now separation of those two structures. So this is a tracheoesophageal fistula class, and it is the most frequent abnormality. 90% of cases occurring with the upper esophagus ending in a blind pouch. So this is now your tracheoesophageal fistula. And depending on the type, you have this. Mhm. So the type 1, type 2, type 3A, 3B, and 3C. Okay. So the type 1, you're going to have your esophageal agenesis there, rare, not included in the classification by Gross. Okay. Type 2, proximal and distal esophageal bud, normal esophagus with a missing mid segment. Okay. Type B here by Gross there. Type C, you have now your proximal esophageal atresia. Your esophagus continues with the mouth ending in a blind loop. Okay, and this is the most common with the distal esophagus arising from the lower trachea or carina. Okay, and then type D here, termination on the lower trachea or carina with the distal esophagus arising from the carina. So you have several types now. If you follow the Gross, you have type A to type H class. So 90% of the cases will be a type C for your Gross or a type 3B for the VOC class. So this is now you have your primary esophageal atresia. Here, this one is the most common. Okay. Next, you have your diaphragmatic hernia. So the diaphragmatic hernia, as I have mentioned before, you now have failure of your pleuroperitoneal foramen to close. Okay. So what happens there? So you have two openings there. So of those two openings, class, you have one on the left side and one at the front of the diaphragm. So this is more common on the left side, which is the foramen of Bokdalek class, which will allow viscera like your intestine, the stomach, or the spleen to enter into the pleural cavity and then will compress the lungs class. And this now will be secondary of the failure to close at week 6. Peritoneal foramen that should have been closed. Okay. So more common would be the Bokdalek, and the rare one is your Morgagni hernia, which is an opening in the front of the diaphragm. Azygos lobe is a common condition. About 0.5% of the population. The right upper lung will expand either in the area of the posterior cardinal veins, okay? But they are asymptomatic, so you do not need to treat them surgically. Okay? Unless you have compression of the phrenic nerve in the presence of your azygos lobe. Another is your congenital laryngeal webs class. The laryngeal abnormality is due to incomplete recanalization of your laryngotracheal tube during the fetal period. So it should recanalize at week 10 class. So at week 8, it is still a solid, like a solid tube. At week 10, it should recanalize class so that you will not form your laryngeal webs. Okay. A rare abnormality among them will be at the level of the vocal folds or your glottis. Okay. The hyaline membrane disease, there, nawala yung description. Anyway, is your respiratory distress syndrome in the fetus class, newborn respiratory distress syndrome, and that is secondary to what? Absence or deficiency of surfactant produced by your type 2 pneumocytes class. Type 2 pneumocytes. And you already have the composition of your surfactant, okay, which is your dipalmitoyl phosphatidylcholine, which is the strongest surfactant molecule class. And this is prevalent. Your HMD is prevalent in premature infants. It accounts for 50% to 70% of deaths in premature infants. And this is also seen in infants of diabetic mothers, infants who experience fetal asphyxia, or maternal-fetal hemorrhage. They will damage the type 2 pneumocytes and multiple birth infants. The clinical features now will be dyspnea, tachypnea, inspiratory retraction of the chest wall, expiratory grunting, cyanosis, and nasal flaring. Treatment. Treatment include administration of your betametasone and a surfactant like medication that they usually use for prematures. Okay, so you can see here the alveolar period here. Okay, there you can see less of your opening of your alveolus class, and this is the X-ray of your respiratory system class. So your hyaline membrane disease are usually seen in premature infants class. So if you deliver the infant at less than 36 weeks, likelihood of your surfactant deficiency will be there. Now, foregut bifurcation here, you're going to have your tracheoesophageal septum, which will partition the esophagus and your respiratory diverticulum at 3 to 4th week of your gestational age class. Arytenoid swellings. The arytenoid swellings will come from your 4th to 6th pharyngeal pouches. So here, enlarge it there. You can see your laryngeal cecum here. Then you have your arytenoid swellings class. And then you have your cricoid, arytenoid, corniculate, and epiglottis forming from the 4th and 6th pharyngeal pouches. Okay, another view. So this is now your glottic area. So this is now your third ventricle. Here you have your neural tube. Then you have your developing heart here. So that is the area now. Anteriorly will be the area where you find your trachea. Posteriorly, that will be the esophagus class. So esophagus, trachea, and then you now have bifurcation of the trachea. And now you're gonna see as it goes down the right and the left bud, lung bud. Okay. So here you have the stomach area anteriorly there. So you have your tracheal lung buds in this area class. So again, heart, lung buds class. You now have your bronchi there area. Okay. So this is the lung bud. So the trachea is there. You now have your bronchi in this area. So this slide will almost tell you all that will be happening in your respiratory system class. So the key tissues here that you have will be the endoderm, mucosal lining, epithelial cells of the alveoli, mesoderm, muscle cartilage, visceral pleura. Stages: embryonic, pseudoglandular, there, canalicular, saccular. So if you follow the phases now, you're going to see from your embryonic to fetal, and then fetal. So pseudoglandular, glandular phase, okay, terminal sac phase, and alveolar phase class. And that would be the last slide.